Well, of course, October is Breast Cancer Awareness Month, and a big decision for some women after a mastectomy is whether or not to have breast reconstruction. It's a conversation that Baptist Health's Dr. Michael Spann, who is a plastic surgeon, has a lot with his patients, and he's joining us this morning. Welcome into the show.
Absolutely.
You were just telling me today is a special day to kind of talk about reconstruction.
Yeah, so about 3 years ago, the Plastic Surgery, American Society of Plastic Surgery developed a program called Breast Reconstruction Awareness Day, which corresponds to the middle of October. So today is Breast Reconstruction Awareness, and what it is really
Bra Day,
Bra Day, right?
That's cute.
It's a nice mnemonic.
Right.
So, and basically what it is to educate women about their options for breast reconstruction.
Okay,
so,
let's talk about some of their options, and there are different kinds of surgeries that you can elect to have, right?
So when I sit down with someone about breast reconstruction, the first thing I say is one option is do nothing at all. And maybe you're somebody coming from an outside institution where you're down in El Dorado where there's not a plastic surgeon, or somewhere else, and you say, well, I can't have breast reconstruction. That's not true. You can have the mastectomy somewhere else and then come back to us for reconstruction a year, 6 months, 10 years. I've had one 20 years later.
There's no hurry on that.
There's no hurry on that.
Yeah.
Now it's nice to have both at the same time. So one thing is do nothing at all. The other one is to use an implant to do the reconstruction. And the third option is to use your body's own tissue.
Okay. And you brought some examples of what you would use for this.
Right. The majority of women today choose an implant-based reconstruction. And there's two ways to get about to that end point. This is the breast implant that we use.
Right.
Some women choose to have a nipple-sparing or skin-sparing mastectomy and go directly to an implant. So that's one stage. We put the implant in, you go in with breast, you come out with breast, you're done. There are some limitations to it. So the majority of women choose a tissue expander. And the way the tissue expander works is during the mastectomy is complete, we go in, we place the expander in, and then over a process of 3 to 4 months, we expand the breast back out to the volume.
So it's sort of to stretch the skin back out?
Okay. Yeah, and you're reforming the breast, and then when that's complete, we come to the implant, and then the final stage would be the nipple reconstruction if that's necessary.
I have some friends who this was the part of the process that they were happy about.
Right.
You know?
This is never an easy choice for women, and the thing about breast cancer is it's not an October disease. You know, this is a year-long disease, and the great thing is the different organizations are bringing focus to this and the options, and I think that largely the reconstruction is something that's underserved. If you look at it, only about 1 in 5 women will choose to have reconstruction, and same number are only informed about their decision. Now, I think locally we do a great job. We have phenomenal surgeons that perform the mastectomies, and the oncologists and the breast surgeons, they kind of lead the process, and we kind of follow them into it.
Absolutely. So only 1 in 5.
Yeah, roughly.
It's amazing.
Yeah.
Are there any women or instances where this is not an option, where they can't have an implant?
I mean, naturally, somebody who's at advanced health, you know, we don't want to put their life at risk for reconstruction. So, and the goal is to treat the cancer. So we don't want to do anything to interfere with that ability to treat. Largely, assuming you're healthy, assuming everything else is okay, most women are going to be candidates.
They can kind of choose their size, too, sometimes,
kind of, especially on this. Now, there is a limit to how large we can go, but they can largely, with the expander, you know, a lot of times women come in with smaller breasts, and we're able to enlarge them as a process of it. So there is something to that. And the fact that they're able to take charge of their own destiny. Right. So, and so you kind of say, you tell me when to stop.
Yeah,
and we kind of get to that
they've
point.
Been through so much through chemo and radiation, and this is something they can claim for themselves, I guess, and decide how they're going to look.
They're finally part of the decision.
What do you hear from some of your patients after they're complete with the reconstruction?
I think the biggest thing is I've had more women cry about the process with me and mainly because when I tell them, when you see a plastic surgeon, it means the cancer's out. And I think that kind of sinks in, like, okay, there is a light at the end of this tunnel. And I think we have a great contingent of plastic surgeons and working and doing the breast reconstruction in the area. So I think for the most part, this is never a diagnosis you want to hear. Unfortunately, it's a very common diagnosis, and I think that women, by and large, are so confident with their choices going through it that, you know, we're just glad to be part of the process.
That's why today, halfway through the month, is the day to kind of talk about this and to let women know that this is an option for them. And like you said, if your surgery is elsewhere or years ago, you can still have this done.
Correct. And if you've had prior reconstruction and your surgeon's gone or you're from somewhere else, find one of our local plastic surgeons. We can always talk to you.
All right. Let's put up the information about Baptist Health. There's the health line. Whether it's questions about this or anything, you can call 1-888-BAPTIST. They can answer your questions or possibly get you set up with a doctor there at Baptist Health so that you can get taken care of. Thank you so much.
Thank you so much. Absolutely. Yes.
Absolutely. All right.